Good morning, Chair Postman, Board Member Volendroff, staff and guests. The lobbies are open and the recording has begun.
Thanks, Dustin. We will convene the Liquor and Cannabis Board Caucus meeting for August 8th, 2023. Member Garrett is on leave today. Our first item today is an update on our Cannabis Central Reporting System, known as CCRS. And Enforcement and Education Director Chandra Brady will give us that update. Good morning.
Good morning, Chair Postman, Board Member Volendroff, and other guests. Thanks for having me. I'll be off camera today, just FYI. I did want to provide a bit of an update on where we're at with CCRS, since we promised that to you and our stakeholders. The Cannabis Central Reporting System is the LCB's current cannabis reporting system. CCRS has been the reporting mechanism that the industry uses to report all the steps that regulated cannabis plants and products follow throughout their lifespan, from seeding to retail sale. CCRS has been in place here since December 2021. It was developed by the LCB with input from the industry. While it is serving its intended purpose to bridge the gap between our former vendor's product and LCB's next traceability system, it was never intended to be LCB's long-term traceability solution. While the reporting requirements are less stringent in CCRS than previous platforms, Leaf Data Systems and BioTrack, it's not fully meeting the needs of the industry nor the LCB. There are reporting and traceability needs that CCRS cannot meet. Just a few examples: industry members can't see what they have reported in CCRS, and delays in data entry of an event occurring at a licensed business causes a delay in necessary enforcement or education actions. Further, our LCB IT staff say that CCRS can reasonably be expected to function for approximately 1 year, but with ongoing maintenance, it can continue for additional years. In early July, the agency issued an RFI, or request for information, to learn more about what services are available that could potentially replace CCRS for long-term use. RFI submissions were due back to us on August 3rd, and we received responses from 7 vendors for that RFI. The information we receive from the RFI will be valuable as we work towards the future, so we can determine a scope and propose an eventual decision package for a new traceability system. We will use the RFI information to help inform our team as we plan for what steps we should take to prepare for the 25-27 biennium. We will solicit input from stakeholders, including licensees, labs, integrators, other state agencies, LCB staff, our board, and lawmakers. In addition, we'll consider the information gathered from the prior cannabis work group and determine the needs of traceability for Washington State prior to issuing the RFP. We may also hire consultants, for example, to support this process. The key reason we're not pursuing CCRS as replacement now is because the agency cannot build this new traceability system while we are also building phase 3 of SMP, our systems modernization project, which is the enforcement and education phase. We anticipate building phase 3 in late spring or summer of 2024. The systems will need to work with each other. The LCB is committed to communicating with licensees, labs, and integrators when we build the scope and pursue the decision package and eventually the RFP. As CCRS was developed and deployed, licensees and commercial integrators were valuable in testing and providing feedback. I'll continue to keep you informed as we move forward with the planning. Did you have any questions?
I do, yeah. Thank you for that. A couple. So it all makes sense to me what you say, but a couple of questions. So on the timing, given that your phase of SMP, is phase 3, and clearly we can't do all those things at one time. How do we, though, ensure, since we won't know what our kind of, let's just call it generically traceability system will be, how do we ensure that SMP, when phase 3 is implemented, has what it needs? Like, there needs to be some flexibility built into it then. So when we do decide what it is, it can integrate into SMP. Do you know what I mean?
Can I just add to that before you
Yeah,
answer that,
please.
Director Wex? So I had a similar question just about how do these two products interface with one another? So I appreciate that question, David.
Well, currently they don't interface with one another. And that is one of the things on our list of things to consider for the scope of both systems. So it's something that we're evaluating. One of the things we're looking at for E&E enforcement education SMP is how do we use technology to our advantage instead of simply just recreating what we have? So are there ways in which we could integrate those two systems which we aren't currently available to us and we just haven't visioned yet? So those are definitely conversations we're having and things that we are writing into both scopes so that we have the ability to see if those are ways that we can be more efficient and effective.
Okay. Yeah, I get, my concern would be we implement SMP phase 3 and then we come up with an idea for traceability and well, SMP doesn't really do that,
Right.
because those
Right.
sorts of things happen sometimes.
Right. But could we have the capability where some of the data that we use for education for a particular case feeds into our reporting system so that the officer or the compliance consultant doesn't have to retype all that? Could that just automatically transfer over? Possibly. And so those are the things that we're looking at. And that's why delaying this a little bit will help with the timing to make sure that we can look at that.
Yeah. And, as far as delay, I guess depends on what we thought was going to happen to it. I ensured somewhat of a delay. I guess I also just look at it as this plan, as I see it, is allowing for really in-depth front-end work of seeking feedback from licensees, integrators, et cetera, talking internally to see the needs of all the divisions, integrating with SMP. We wouldn't always do, as you said, perhaps even hiring a consultant to help us at some point on that front end, but it's a really robust interaction as the front end.
I completely agree, board chair, and delay was not the right word for me to use.
No, I mean, it is. I get it. Yeah, I just want to say it's not like we're doing nothing for that time period. We're pushing to the right on the timeline for a reason here.
Yeah, it's really work we need to do. And so
Yeah.
we're just building time in the project to do some research and stakeholder work so we know exactly where we want to be. So
great. And then the only thing I wondered, and you and I talked about this briefly last week, but we have CCRS, which, was not meant to be permanent. Sounds like it couldn't be in its current structure. But as part of our review, will we look at what could we do with it? How can it be modernized, fixed up? Is that an option at all in this scheme of thinking?
yeah, so part of our plan does include looking to see if there are things, and there will have to be things that we do to keep it up to date, at least in its current state moving forward. And then are there things to make it more useful for our licensees and staff in the interim?
How about even going on, though? I mean, in terms of, we don't know what we're doing here, whether it's going to be, I don't want to use any words because then people get too hung up on it, but whatever traceability type system is out there, we're looking at these various things as one of those options. It just seems we should at least look at, okay, what could we do? How could we transform CCRS into a long-term system if that seems to be the best one?
Yeah, I hear you, and that's a conversation we can have. I have never seen the agency refer to hanging on to CCRS as a potential long-term solution as one of our options. And so while we're writing the scope for the project and the charter right now, we're at a point where we need to finalize that decision. And if we want to consider CCRS as a potential viable option in the future, we need to write that in. Right now, it's written, although not finalized and approved, it's written as if CCRS is not one of the options to consider for the future.
Well, we should get the benefit of our stakeholder input and other input, it seems to me, before we write that down in, in stone. Carve
Yeah.
that in stone.
Let's have some conversation about that.
Okay. All right. Yeah. I'm about, saving as many options as possible early in this process.
Great. I'm glad we had this conversation.
Me too. Okay.
I just have a quick question about
Yes.
the RFI. So it sounds like you received a number of 6 or 7 responses. One thing I offered to Will that I just want to put out here again is to not forget that board members have varying degrees of experience reviewing RFIs, reviewing RFPs, developing RFIs, developing RFPs. And I would love to be a part of that conversation. Is there a role for board members moving forward in any part of the process of review and development moving forward? So just I want to put that out there.
Absolutely. And just so you know, our board is listed as a stakeholder as well. So as we move forward to finalize the charter and all of those things, we will involve you in that. So thank you for the reminder, and we'll make sure we keep you informed.
Great. Thank you.
Great. Okay. Thank you, Director. Appreciate it. Our next item is update on our new research program, and we will turn to Dr. Kathy Hoffman, the research manager.
Good morning, Chair. Pardon me?
Who may look familiar from her previous role. You may know her
met
from
her
such
met her
things such
before.
as rules and policy. Yes.
Yeah, I think I mentioned that I would be lurking around still, and here I am, my first lurk. So good morning, Chair Postman and Board Member Vollendroff. The first news that I want to report is that we have hired for our 2 positions in the research unit. And I reached out to both of our new employees, and they provided some write-ups, and they're relatively brief. So if I may, I'd like to share them with you now so you can hear how they sort of speak about themselves. So our operational research specialist is Dr. Sarah Oki, and she holds a PhD in clinical psychology and has over 10 years experience conducting scientific research, disseminating substance use education, and spearheading program development across various sectors, including healthcare, industry, and academia. With expertise on both the benefits and consequences of substance use, Dr. Oki has authored numerous peer-reviewed publications, presented at several national conferences, and taught multiple undergraduate courses. Her additional experience conducting intervention and research for a range of mental health and substance use problems has given her a unique perspective on areas for growth in advancing our community's well-being. Dr. Oki is a strong advocate for using science to inform public policy and to disseminate trustworthy education to the public. And Dr. Oki begins with us on August 16th, so just around the corner.
Hey.
All right, and then with respect to our second position, and that was for the research analyst, we are welcoming Dr. Steven Ziegler to join us, and he is a medical legal expert. If you don't know what that is, I looked it up so I can tell you what that is. We're at the, once I introduce his background. Anyway, he is a medical legal expert and a social scientist who has over 20 years of experience in drug control policy research and development that focused on ensuring safe access while also preventing abuse and harm. Steve has published over 35 peer-reviewed articles, delivered talks domestically and internationally, and served as the medico-legal consultant to industry, government, and both the legal and medical communities. Steve was also a research fellow in Switzerland at the University of Zurich's Institute of Legal Medicine, was a National Pain Fellow, a former prosecutor, defense attorney, and federal task force officer for the DEA at the U.S. Department of Justice.
Wow.
He will also be joining us on August 16th.
Those are two impressive resumes.
I'm very excited to bring this team together, and we're I think yeah, I'll just leave it at that. Really excited. Any comments?
Just, it sounds like you found great people, and you know, like I told you, I picture the three of you doctors sitting in your wood paneled faculty club that you're building somewhere in our building. So I look forward to that.
Yeah, I'm
Yeah.
really excited, Kathy. Congratulations on pulling together a what sounds like a fantastic team. I do have one question, and that is, can you tell us just a little bit about the conversation you had with both of the applicants around our role of regulating, licensing, public policy, and then advancing business at the same time, just so we can get a sense of where they stand in regard to that?
That's a really great question, and one of the things that we really emphasized in interviews is that what this unit is trying to do is bridge the gap between all of that, what we see out in the field, in the research that we see, in the work that we do, filling in the gaps between all of that and regulation, right? And then informing legislation as well, moving forward, right? We also had discussions about how we support internal staff in program development, in the research that they'll be doing. And there are gaps to be bridged there as well. Sometimes there's, and I'm not talking about operational communication gaps, but sometimes in the kind of the work that we're doing and what we need to know and what we need to do, there are those research gaps that we're trying to fill in. The other thing that I want to say that I think is really important is the language gaps. And by that, I mean, and I just came from the Cannabis Research Conference, and we were talking about this during the conference, but the language gaps between academia, scientific research, even the way some of enforcement language, there are terms that are used that don't necessarily translate into the regulatory or legislative space, or even in the work that we do every day. So our unit will work to bridge those gaps and find common language so that we are doing data-driven policy, but data isn't limited just to numbers. It's also going to be from narrative data that I think we can agree there isn't enough mixed methods research. We rely heavily on data from statistics in the work that we do, and we're going to be trying to weave some of the qualitative data into our work as well. And Jim, I hope that answered the question.
Yeah, it did. But I'll just actually be a little bit more forthright in what I'm asking. And that is that,
Yes.
so when I interviewed, it was very clear to me that there was no interest in having somebody on the board that was a prohibitionist, for example. And I just want to see, were we that explicit with the researchers around our role of helping advance business? Because this is also about the work that we have to do around regulating and education, etc. But it's also about how do we help businesses thrive in this industry in Washington State?
Absolutely, and thank you for the clarification. The full authorizing environment was presented and discussed during the interviews to get directly at your question. That this is not, our research unit isn't just focusing on substance use or how the product is grown, so on and so forth. What our products are created, right? What we're looking at is how do we support businesses to the extent that we can within our authority.
Great. Thank you for that.
You're welcome. Sorry.
Yeah, I would just add on that the other piece of that is both with cannabis and alcohol, we operate under a mandate from the voter.
We do.
And, that's we're in the business of carrying out the mandate that the voters have given us in the two initiatives there that reworked both those products. And so, yeah, and I'm glad that, and I think we all inside the building today understand that. Our public health advocate understands that, right? Like we're all working together in this big global thing. So I think that was a great question.
Yeah, I think some of the discussion during interviews included sort of finding that balance between supporting business, but also, paying attention to our goal of assuring, safe product and public health.
Yeah.
And,
That's our mission
balancing all
statement.
of those things. I'm sorry.
That's our mission statement.
Yes,
Public
it
health and
is.
public safety.
And across our line of business, if you will, just clarify,
Correct.
making sure this is not focused on one particular product, but across all of the things that are under our regulation authority and licensing.
Right.
All right, so I've got a list of things that we'll be working on, and some of these I'm already working on now, but just so we can discuss it in caucus here if you have any questions. One of the first things we want to start doing is establishing quarterly meetings with UW, WSU, and others to share recent, the latest research findings, because we are seeing a lot more, published literature than we used to. We've been at this a few years now on the cannabis side, and I think, alcohol regulation and policy continues to evolve as well. We do want to submit monthly update on published research, and that is something that we're going to put on our outward facing website so that people can see research briefs that kind of help to decipher some of the literature that's out there that can be kind of dense and difficult to read. So we're hoping to provide those within the first few months of putting the unit together, and those will be fashioned kind of after the LNI Sharp research unit. That's a research unit within labor and industries. And they almost do like a one-page briefing on relevant research. And so we'll make those publicly available so folks can tap into them as well. I'll do bi-weekly updates at Caucus like I'm doing today to kind of tell you what's going on and what we're up to. We also want to establish a monthly research spotlight for the agency, and that's something that we can also put on our outward facing webpage as well to make sure everyone has access to that. We are going to begin to create decision tools so we can have a way to prioritize the work that we do both internally and externally. And so the way that we arrive at the decisions on what we're going to do is really clear, and the priority is really clear as well. Let's see. We are going to build a web page. That probably will take a few months. I don't anticipate that that's going to happen overnight. We also want to establish an internal research library.
Great.
We want to provide as much externally as we can. There may be some limitations based on, copyright for certain documents that we may be looking at, but more on that. I'm also meeting with the Washington State Institutional Review Board today to see what kind of relationship we'll be having with them, even though I do suspect it's going to be several months before we do any sort of original research. But we want to make sure that conversation happens earlier in our unit's life than later. We're also going to start reaching out to legislators in the not too distant future. I think Mark and I would like to. Mark's working on a time when it would be good for me to meet with Senator Kaiser and her committee, and Senators Klova and Wiley in their committee as well, to find out when we can start having those conversations with them. Also want to start looking at other state agencies and Washington State partners who may have relevant data that we'd like to look at. Some of that's already happening right now. I've begun to reach out to King County Public Health. Well, no, I haven't reached out to King County Public Health. I've reached out to Thurston County for some population level data. So we're already starting to make those connections. I met with Julia Dilley this morning.
Oh, good.
To talk about how we could work together on the ISLC data, how we can use that data, and how we can help inform that data as well. And I've also been allowed to join their work group. So I'm really excited about that. And I think I already talked about that. The other thing that we'll be doing on a continual basis is just scanning our authorizing environment. So that's state, county, international sort of areas about emerging issues, emerging products, and emerging practices. And that takes, I think that is something that's really important for this research unit to do, as well as being involved with NCANRA and the NCSLA, so that we can be kind of at the forefront, so to speak, of what's happening in all the areas that we regulate to the extent that we can. And this sounds like a tall order for a 3-person unit that's just getting started, and it is, but I think we have high aspirations and some pretty lofty goals for what we'd like to see the unit do in the first year. And I think we're going to be off to a really great start. And I'll stop right there.
Great. Yeah, I have no doubt you will be off to a great start. Looking forward to all that work. Anything else, Jim?
Nope.
Okay, great. Thank
Thank
you.
you.
Thank
Good
you. And I just thank you. I did also want to say I did mention the cannabis research conference that I was at in Denver. Part of last week and through the weekend, and I will report out at EMT in September on
Great.
that.
Thank you.
Okay,
Lots
good.
of material to share. Thank
Yeah.
you.
Thanks so much. Okay, that takes us to board member and executive assistant reports. Dustin, anything today?
Not today. Thank you, Chair.
Jim, anything more to add?
Nothing today. Thank you.
Only thing for me is just a reminder, tomorrow we have executive management team at 1:30, where the board hears from directors on updates of internal operations. And other than that, we'll see you all tomorrow afternoon. Thanks, everybody. We will adjourn the caucus meeting for August 8th, 2023. See you later.
Thank you. Bye.
Bye-bye.